Hello friends, welcome back to our channel with new most important video for you, that is prostate cancer. Prostate cancer is one of the most common health concerns that men over the age of 40 face across Europe, America, and Canada, yet so many people either overlook the early warning signs or dismiss them as normal changes of aging. The truth is, prostate cancer often develops slowly, and in the beginning it may show little to no symptoms at all, which is exactly why awareness is so important. Imagine how many lives could be saved if men and their families understood the subtle clues their bodies give before the condition becomes advanced. Let's take a deep, honest, and clear journey into understanding these warning signs, because the earlier you catch them, the higher your chances of living a long, healthy, and fulfilling life. One of the first signs that something may not be right is difficulty in urination. Many men notice a weaker stream, a sudden urgency to go, or the need to strain when passing urine. At first it might seem like just a small inconvenience, but the prostate sits right below the bladder and surrounds the urethra, so any abnormal growth can begin to press on that passageway, creating obstruction and discomfort. Another red flag is waking up multiple times at night to urinate, a condition called nocturia. While it's true that other issues like an enlarged prostate or even lifestyle factors such as drinking too much fluid before bed can cause this, frequent nighttime trips to the bathroom should never be ignored, especially if it becomes persistent. Then there's the experience of feeling as though the bladder hasn't completely emptied even after urination. This is a subtle but important sign. Men sometimes brush this off, assuming it's nothing serious, but it can actually indicate that the prostate is enlarging or being affected by abnormal cell growth. Blood in the urine or semen is another warning signal that cannot be ignored. Though it can be frightening, and though there are other possible explanations, seeing even a small trace of blood is something that should be checked by a healthcare professional immediately. Pain or discomfort in the pelvic area, hips, or lower back can also appear when prostate cancer begins to spread beyond the prostate gland. Unfortunately, many men delay seeking help at this stage, believing the discomfort is from aging, arthritis, or physical activity, but pain that doesn't improve with rest should always be taken seriously. Some men may also notice erectile dysfunction, a reduced sexual drive, or difficulty maintaining erections. While this can be influenced by many other factors like stress, lifestyle, or other health conditions, prostate cancer can sometimes be behind these changes. In advanced stages, unexplained weight loss, fatigue, or bone pain can occur, which means the disease has moved beyond the prostate. These late signs are far more dangerous, which makes catching the early subtle ones so crucial. Now let's talk about risk factors. Age is one of the biggest, with men over 50 being at higher risk, but family history plays a massive role as well. If your father, brother, or uncle had prostate cancer, your own chances of developing it rise significantly. Ethnicity also matters. For example, African American men are at a higher risk of both developing prostate cancer and having more aggressive forms of the disease. Diet and lifestyle are important too. Diets high in processed foods, unhealthy fats, and red meat combined with low levels of fruits, vegetables, and exercise can increase the risk. On the other hand, a lifestyle full of regular physical activity, balanced nutrition, and healthy weight management can significantly lower it. Another crucial point for awareness is the prostate-specific antigen blood test, commonly known as the PSA test. While there's debate around over-testing, it remains one of the most effective tools to detect prostate issues early. Regular checkups with your doctor can help detect potential concerns before they become life-threatening. If you are in your 40s or 50s, and especially if you have a family history of prostate cancer, you should definitely consider having this conversation with your healthcare provider. Beyond clinical signs, mental health plays a huge role in this discussion. Many men avoid talking about their health out of fear, embarrassment, or simply a culture of silence, but breaking this silence can literally save lives. Talking openly with your loved ones, your doctor, or support groups can not only help detect the disease early but also provide the emotional strength needed to face it. Think of how impactful it would be if more men spoke to their friends about getting checked, rather than waiting until advanced symptoms appear. Stories from survivors show us the power of awareness. Many men who caught the disease early through routine checkups or recognizing small signs are now living long, healthy lives with their families. Contrast that with those who waited until late symptoms appeared and faced much more challenging treatments. Another layer we cannot ignore is lifestyle modification for prevention. Eating more tomatoes, broccoli, green tea, and foods rich in antioxidants may help reduce risk. Omega-3 fatty acids found in fish can be beneficial, and maintaining a diet rich in plant-based foods helps overall prostate health. Regular exercise improves hormone balance, reduces inflammation, and boosts immunity, all of which are protective. Even something as simple as walking 30 minutes a day can create long-term health benefits. Stress management also ties in. Chronic stress can lead to hormone imbalances and inflammation, which may negatively impact prostate health. Simple practices like meditation, yoga, breathing exercises, or spending time in nature can lower stress and contribute to overall well-being. Alcohol consumption should be kept moderate, and smoking should be avoided, as both can increase the risk of cancer in general, including prostate cancer. Men in Europe, America, and Canada often have access to excellent healthcare, yet many still don't take advantage of screenings until it's too late. This is partly cultural, partly fear-based, but changing this mindset is key. Imagine if checking for prostate cancer became as routine and normalized as checking blood pressure or cholesterol. Awareness campaigns are trying to move society in that direction, but it starts with individuals taking responsibility. If you're watching this and you're in your 40s or older, or if you have a loved one who is, now is the time to act. Talk to your doctor, schedule a checkup, and learn about your options. Don't let fear or embarrassment hold you back. It's far braver to take care of yourself for the people who love you than to pretend everything is fine. Every year, thousands of men are diagnosed, but thousands also survive because of early detection. Treatments today are far more advanced than they were even a decade ago. From surgery to radiation to innovative therapies, options exist to help men live long, fulfilling lives after diagnosis. The journey may not always be easy, but it is a journey of hope if action is taken early. Awareness is the most powerful tool we have, and awareness begins with understanding the signs. Weak urine flow, frequent nighttime urination, pain or discomfort, erectile difficulties, blood in urine or semen, these are not things to ignore or hide. They are your body's way of whispering that something needs attention before it shouts in the form of advanced disease. If you take just one thing from this discussion, let it be this: listen to your body and respect its signals. You wouldn't ignore a warning light on your car dashboard, so why ignore the warning signals of your own body? Take them seriously, seek help, and encourage others to do the same. Together, we can change the way men approach their health and ensure that more fathers, brothers, and sons are here for years to come, living, loving, and thriving. If you like this video, then please like, share, comment, and subscribe our channel. Thank you.